Let's begin by breaking down today's title because it reveals a hidden danger most seniors are never warned about. The main health problem we're talking about today is sarcopenia. That's the medical term for age-related muscle loss. Now, after you turn 60, muscle loss doesn't just continue, it accelerates. Studies show it can actually triple compared to the decades before. This is incredibly dangerous because your muscles aren't just for strength. They control your balance, your blood sugar, your metabolism, and even your ability to survive after an illness or a fall. But here's the good news. The solution I'm going to share with you is one daily habit. It's not a drug, it's not surgery, and it's not some kind of intense, grueling exercise. It's a simple habit that has been shown to slow, stop, and even partially reverse muscle loss within just 30 days when it's done correctly. This habit is critical because once that muscle is lost, your independence, your mobility, and your overall quality of life can quickly follow. So let me ask you a really important question. If muscle loss after 60 is so dangerous, why are so few seniors ever warned about it? Here's the truth. After age 60, adults lose about 1 to 2% of their muscle every single year. But here's the really shocking part: after you turn 70, that loss can jump to 3 or even 4% per year. That means within just a few years, everyday tasks like climbing a flight of stairs, standing up from a comfortable chair, or carrying in the groceries become exhausting or even impossible. And the thing about muscle loss is that it doesn't announce itself with pain. It happens silently. Most seniors don't even realize it's happening until the first fall, the first fracture, the first stay in a hospital. And the statistics are sobering. After one major fall, a staggering 50% of seniors never regain their full independence. That's why this matters so much. Ignoring muscle loss doesn't just weaken your body, it literally shortens your healthy lifespan. Now, let me explain why you should trust what you're about to hear. For over 30 years, geriatric physicians and clinical researchers have been studying aging muscle. One of the most cited experts in this field is a board-certified geriatric physician who has treated over 18,000 patients between the ages of 60 and 90. In his clinical programs, seniors who followed targeted daily muscle-preserving habits saw measurable strength improvements in over 70% of cases, often within the very first month. This isn't just theory. This isn't some random internet advice. This is clinical aging medicine, backed by decades of research. So what's actually happening inside your body that causes this? As we age, 3 major biological changes start to attack our muscles all at the same time. First, protein synthesis slows down. This means your muscles stop responding to the food you eat the way they used to. You might be eating the exact same meals you always have, but your body is building far less muscle from them. Second, your hormonal signals decline. Key hormones like growth hormone, testosterone, and your sensitivity to insulin all drop with age. These are absolutely essential for muscle repair and maintenance. So when they decline, your body's ability to keep your muscles strong declines with them. Third, chronic inflammation increases. This is a low-grade, quiet inflammation that slowly damages muscle fibers over time, even if you feel generally healthy. This combination of slowing protein synthesis, declining hormones, and increasing inflammation creates the perfect storm for sarcopenia. And here's the most dangerous part of all. If your muscles are not stimulated correctly every single day, your body begins to actively replace that precious muscle tissue with fat and connective tissue. Once that process starts, weakness accelerates at a rapid pace. Now, let's talk about some of the common mistakes that well-meaning seniors are unknowingly making. Mistake number 1: believing that walking alone is enough. Walking is absolutely excellent for your heart, but multiple studies show it does very little to stop muscle loss, especially in the critical muscles of your legs, hips, and core. One study published in the Journal of Aging found that seniors who only walked lost nearly the same amount of muscle mass as those who were completely sedentary. I'll never forget a patient of a colleague named Robert, who was 72. He walked every single morning for 45 minutes, believing he was doing everything right to protect his health. Yet within just 2 years, he was struggling to rise from a chair without using his arms. His leg strength had quietly declined by over 30% despite his daily walks. Mistake number 2 is eating too little protein or spreading it out incorrectly throughout the day. As we get older, our appetite often declines and we tend to eat less. But the research is clear. Adults over 60 actually need more protein per meal, not less. Inadequate protein intake accelerates muscle breakdown, especially overnight while you sleep. A study found that seniors who consumed low amounts of protein lost muscle twice as fast as those who were meeting their daily targets. And mistake number 3 is avoiding resistance because of fear. Many seniors believe that lifting weights or doing any kind of resistance exercise is dangerous. In reality, avoiding resistance is what causes the weakness in the first place. Clinical trials have shown that properly guided resistance habits can reduce the risk of falling by over 40%. It's not the resistance that's dangerous. It's the weakness that comes from avoiding it. So here is the daily habit that changes everything. The habit is daily muscle activation using light resistance combined with strategic protein timing. Let me be clear, this is not about heavy lifting. This is not about gym culture or becoming a bodybuilder. This is about controlled, safe, and medically recommended stimulation for your muscles. When your muscles are gently challenged every single day, even for just 10 to 15 minutes, your body gets a powerful signal. That signal says, preserve this tissue. We need it. Studies show that seniors who activate their muscles daily experience incredible benefits. They see increased muscle protein synthesis within just 7 days. They have improved balance and grip strength within 2 to 3 weeks. And they can see measurable muscle mass stabilization or even gain within 30 days. The science is absolutely clear on this. For older adults, muscle responds to frequency, not necessarily intensity. So here is exactly how you can apply this safely at home. Step 1 is daily resistance activation. This can be as simple as doing chair stands sitting down and standing up from a sturdy chair without using your hands. It can be wall push-ups, using resistance bands, or lifting very light dumbbells. The goal is slow, controlled movement, not pushing yourself to exhaustion. Step 2 is protein timing. This is crucial. You want to consume a protein-rich meal or snack within 1 to 2 hours after your activation session. This dramatically increases your body's muscle repair response, making sure that the work you just did actually builds and preserves muscle. And step 3 is consistency over perfection. Missing a day here and there weakens the signal you're sending to your body. Daily activation is what keeps your muscles awake and ready to work. One clinical study showed that seniors who followed this exact approach, daily activation, plus protein timing, reduced their rate of muscle loss by over 60% in just 1 month. Before we continue, let me speak directly to you for a moment. If you are over 60, if you care deeply about staying independent, if you want to avoid walkers, nursing homes, and hospital stays, then this channel exists for you. Please take a moment to like this video, subscribe to the channel, and maybe even comment your age below. This helps us reach more seniors who desperately need this life-changing information. Now let's close with something really important. Muscle is not about appearance. It's not about looking good at the beach. Muscle is about freedom. It's the freedom to stand up from the dinner table without help. It's the freedom to climb stairs with confidence. It's about protecting your bones, your balance, and ultimately, your life. The best news of all is this: muscle loss after 60 is not inevitable. It's not a mandatory part of aging. With one simple daily habit, done safely and consistently, you can protect your strength, preserve your independence, and extend your quality years, not just your lifespan. Thank you for watching. Stay with us, subscribe, and always remember aging does not mean surrendering your strength.